Neurosurgery can significantly alter one's quality of life. Finding the best neurosurgeon is one of the most important decisions that a person can make.
My name is Dr. Jack Liggett. 4 years ago, Dr. Mario Ammirati removed a malignant tumor from my brain, a very bad prognostic one. I was so grateful to be able to recuperate from the surgery, and within several months, maybe 6 to 9 months, to start taking some vacations. And we took some cruises, and they were very nice. And it was great to be able to do that so soon after surgery. And I was grateful to Dr. Ammirati because he got me back on my feet.
Dr. Liggett had one of the biggest malignant brain tumors that I have ever seen. He had a glioblastoma multiforme, that is the same type of tumor that killed in less than 1 year Senators McCain and Kennedy. I am so happy of seeing him being alive and being able to enjoy the life, travel the world, and enjoy his grandchildren. That really makes sense of all the effort that we put into treating our patients.
Meet Dr. Mario Ammirati, board-certified neurosurgeon who brings more than 25 years of experience in performing thousands of neurosurgical procedures. He's one of the world's foremost leaders in diagnosing, removing, and treating malignant brain tumors with care and precision, while prioritizing his patients' quality of life and physical functions.
My name is Mario Ammirati. I am a neurosurgeon. I work at Sharp Grossmont in San Diego. I trained at Northwestern University Medical School. That was a 7-year training. After completion of this training, I did extra specialized training in surgery of skull-base tumors in Germany with Professor Sami, who is considered to be the best skull-base surgeon in the world. I worked at UCLA Medical Center. That was really my first job after I finished my fellowship. And then I worked at University of California, Irvine, where I was a tenured associate professor and interim chairman. Eventually, I moved to the Ohio State University in Columbus, Ohio, where I was a tenured professor of neurosurgery for over 10 years. I had a skull-based lab, a lab that did research on skull-based surgery for over 20 years. I have trained more than 120 between fellows and residents throughout my career. I have operated on more than 4,000 patients with brain and spine conditions. I have published more than 160 peer-reviewed papers, and I have written many books and book chapters throughout the years. I have been invited to speak at many national and international meetings. I have written the guidelines together with others for the treatment of brain metastasis, as well as for the treatment of primary brain tumors. About 1 year ago, I moved back home to Southern California. I started my private practice in San Diego, also to be closer to my family who lives here in San Diego.
Dr. Ammirati has delivered hope to thousands of patients, many of whom were undiagnosed or misdiagnosed. His treatment philosophy is based on adherence to the most up-to-date, reliable scientific evidence, which he uses to create innovative approaches that he customizes to each unique patient.
The young lady with a benign brain tumor, a tumor that is called vestibular schwannoma or acoustic neuroma. The tumor was a giant tumor, so she was having problem with headache as well as with her balance. She was unable to walk straight. We operated, and was a long operation, but at the end of surgery, she came out with no new deficit. Her ability to move her face, that often is compromised when you remove this giant vestibular schwannoma, was maintained 100%. And she regained the ability to walk very well on a straight line. Vestibular schwannoma are very well treated with non-surgical means like radiosurgery using the gamma knife or other radiosurgical tools. But larger tumors, like the one that I operate, they really are not amenable to radiosurgery or any other form of radiation therapy, so they really need to be operated. And that's really what my practice focuses on. One patient that comes to mind is a 66-year-old, very nice lady who we treated a couple of years ago. She had literally over the course of the previous year, she had lost her mind, she had lost the ability to walk, and she was unable to control her bladder. When she came to see me, she was wheelchair bound. She had seen many other neurologists and doctors who had diagnosed her with dementia. When I saw her, I was quite confident that she had a condition called normal pressure hydrocephalus, where the amount of water that everybody has in the brain, but in this condition is more than what should be. And I proposed to her to treat this condition with a very simple neurosurgical procedure that is putting a tube in her brain and draining the excess water into her belly. What happened to the wheelchair now?
The wheelchair happily is in our basement.
That's good to know. How are you feeling now?
Excellent. Regained all my thought process. I am able to do housework and have a normal living.
Right. So do you think surgery helped you?
Yes, definitely.
Excellent. Can you show us how you walk now, please?
Sure.
Very good. And you were not able to walk like that before?
No, I was totally wheelchair bound and had to be transferred from chair to wheelchair.
Oh, great. All right, well, that's all. I mean, we will use this one in order to increase awareness of NPH, that is normal pressure hydrocephalus.
That's a big word. I am really glad I had the surgery. I think that it made me be able to retain my normal life again.
Thank you so much. Thanks. We operated on her, and after a few weeks, she had gotten rid of her wheelchair, and she was able to control her bladder, and their cognitive function, they came back almost back to normal. And I think that what allowed me to make this diagnosis was just based on the experience that I have had treating more than 4,000 patients with neurosurgical condition over the course of my career. To me, as a neurosurgeon, that's something that comes my way, every day. But to the individual patients, that's a life-changing event that comes, once in a lifetime. So I am very cognizant.
With the opening of his private practice in San Diego, Dr. Mario Ammirati is coming back home to deliver hope to many more.